Good evening to all. The 12th research theme that we'll be discussing today is from the research article Rahman 2012. This highlights an importance on the area of imbalance between oxidants as well as antioxidants. So, who are these oxidants and antioxidants? Well, oxidants are generally free radicals, and antioxidants are scavenger molecules that reduce this effect of free radicals. So, free radicals are generally a very vigorous reactive chemical species. And to reduce the effect of these vigorousness, we should be intaking a lot of antioxidant. So, as you can see, this diagram depicts a kind of a seesaw structure where the reactive oxygen species are at a high level due to the weight it's level down, whereas antioxidants are on top because of the high amount of antioxidants available. So there are examples of these reactive oxygen species, including hydrogen peroxide, superoxide, hydroxyl radical. And antioxidants includes a lot of enzymes like GSH reductases, superoxide dismutases, catalases, and even metabolites like lactate and pyruvate. So free radicals not only include reactive oxygen species but also reactive nitrogen species. So what they do is they interact with the biomolecules like proteins, carbohydrates, and lipids and cause a change in the cellular balance, that is a homeostasis, intra and intercellular homeostasis, until the cell dies or the cell will regenerate. So, if we categorize the reactive, or rather the free radicals, we have reactive oxygen species and nitrogen species. And under these classifications, when you try to give some examples, as I said before, superoxides and even hypochlorous acid, and nitrites include nitrate, nitroxyl, peroxynitrite, and all these sends a message or acts as a messenger of information to the nucleus for the metabolism. So when these mediators of intra and intercellular signaling gets activated, right, they can tend to change the cell volume. Uh, the protection of the nucleus can be altered. Even modulation of enzyme activity can take place, right, and even maintenance of the vascular tone can get modified. And especially the transport of certain intracellular ions can be affected. So this is how high amount of ROS as well as low amount of antioxidants can lead to a metabolic stress known as oxidative stress. And that is what is depicted from this research study.